In our last video, we talked about how hormones are your body's master communicators and how their erratic signals during perimenopause can lead to a wide range of confusing symptoms. Before we dive deeper, a quick but important medical disclaimer. The information in this video is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard in this video. Today, we're going to zoom in on one of the most talked about hormones in women's health, estrogen. Now, when most people hear estrogen, they often think of a single hormone, or perhaps just its role in feminizing features. But the truth is, estrogen is not just one story. Our bodies actually make different types of estrogen, each with unique roles and signals. Understanding these distinctions is absolutely crucial, especially when we talk about hormone replacement therapy and optimizing your health during perimenopause. Let's start with estradiol, often referred to as E2. This is the primary estrogen produced by your ovaries during your reproductive years, and it's incredibly powerful. E2 is vital for supporting a vast array of bodily functions. At a cellular level, estradiol exerts much of its influence by binding to specific estrogen receptors called ER-alpha receptors. Once bound, it can trigger what's called genomic signaling. Essentially, it travels to the cell's nucleus and directly influences gene expression. This instructs your cells on fundamental processes driving overall growth and maintenance throughout your body. Think of it as the hormone that helps keep your tissues healthy and vibrant, from your skin to your hair to your bones, brain cells, and cardiovascular system. Because these ER-alpha receptors are widely distributed throughout your body, E2 is essential for consistent energy, balanced mood, and even robust libido. As we approach and move through perimenopause, estradiol levels can become quite unpredictable. This leads to many common and frustrating symptoms like hot flashes, night sweats, brain fog, difficulty concentrating, mood swings, changes in sleep patterns, and even vaginal dryness and painful intercourse, all of which happen when your body's vital communication system becomes jumpy. While estradiol, or E2, is the most potent estrogen during your reproductive years, it's worth briefly mentioning estrone, or E1. E1 is another naturally occurring estrogen and becomes the predominant estrogen after menopause, particularly originating in fat cells. Now, let's talk about estriol, or E3. This is where the story gets really interesting, and where we often find a key to more balanced and protective hormone therapy. Estriol is often referred to as the protective or calming estrogen, and for good reason. While estradiol sends signals for general growth, estriol sends signals for control of that growth. It acts like a brake on excessive cell division, helping to maintain balance and protect your tissues. This is a significant distinction. Now, you might wonder why we often discuss estriol, or E3, and estrogen associated with pregnancy for perimenopausal hormone therapy, instead of focusing on estrone, which is so prevalent in menopause. The reason lies in their specific cellular actions. While E1 is abundant and tends to have more proliferative effects, instead, research has highlighted E3's unique protective and controlled growth properties, making it a highly desirable and beneficial therapeutic estrogen to include in a customized hormone therapy regimen. Research suggests that estriol plays a profound role in various aspects of your health, far beyond what many realize. It has anti-cancer effects. It helps protect against various cancers, including ovarian, colorectal, and even some brain tumors. It has anti-inflammatory properties. Estriol helps reduce systemic inflammation throughout the body, which is a root cause of many chronic and autoimmune diseases. It provides brain support. It plays a role in calming the brain and supporting cognitive function, which can be incredibly helpful for that perimenopausal brain fog and anxiety. It can help with gut health. Estriol is essential for maintaining a healthy gut lining and preventing leaky gut, which can impact your immune system and overall health. It can also help with bone health, contributing to strong bones and helps prevent bone loss even as we age. And lastly, it can even assist with healthy fat metabolism. Now, a common misconception you might hear is that your body will simply convert enough estradiol, or E2, into estriol, or E3, to get all these protective benefits. Unfortunately, relying solely on this conversion isn't always reliable or sufficient. While some conversion does occur, studies show that it doesn't consistently reach therapeutic levels in everyone. In general, taking estradiol leaves out many of the comprehensive protective benefits of estriol. Our bodies are complex, and this conversion pathway can be influenced by many factors, including genetics, gut health, and nutrient status. This is precisely why strategically adding estriol alongside estradiol can be so crucial for effectively managing hormones in menopause. This combination of E2 and E3 is often called Biest in the naturopathic and functional medicine communities, short for biestrogen. This is typically obtained from a compounding pharmacy in various ratios of E3 to E2, but the most common is an 80-20 ratio, 80% estriol and 20% estradiol. This ratio has been optimized over tens of thousands of patients to maximize the benefits of both hormones. It's about providing your body with both the necessary growth signals from E2 and the vital protective and calming signals from E3. By using estradiol and estriol, we are aiming to more closely resemble the body's natural balance, particularly that of younger, healthier women who tend to have higher levels of this protective estriol. Understanding the nuances of estrogen, especially the powerful role of estriol, is a game changer in how we approach perimenopausal health. In our next video, we're going to expand our discussion beyond estrogen and explore the critical role of progesterone in women's health during this transition. If you found this information helpful, please give this video a thumbs up, subscribe to the channel so you don't miss our next deep dive, and share it with someone who needs to hear this message. Remember, you deserve to feel your best. And with the right knowledge and personalized support, you can navigate perimenopause with confidence and vitality. I'm Dr. Morse, a licensed naturopathic doctor serving patients throughout Arizona, and I look forward to continuing this conversation with you.